it's a privilege for us to have universal coverage of health financing. It really solves a lot of problems that we don't need to struggle individually or as individual families to try to get access. And the mechanisms that the system have in place is quite good. It developed over many decades. Initially, just a decision on what should be provided free of charge in essential medicine. So it's more about very simple medicines in primary healthcare. But over time, it expanded to include more and more medicines, and lately, even new treatments, new medications. But the challenge for new medication is usually they're much more expensive and costly to the overall financing scheme. So decision has been very careful. So as mentioned, there are two level or two phases of negotiation. The decision to include in essential medicine list is one phase. Actually, before that, they have to register, register with the FDA, the Thai FDA. That one doesn't include any price negotiation or economic consideration. It's usually safety, efficacy, all the routine. But the negotiation on the price and the affordability happen at the Essential Medicine Committee. They actually one subcommittee or working group that deal with negotiation, and this basically group will look into information about the effectiveness, the side effects, the cost per quality, and others, and will negotiate with the sellers. And usually they do it not just one companies, but with multiple similar Me Too drugs, those. And that's one price to decide whether which medicine will be included. But once included, then the actual purchase and negotiation will also use this information to negotiate further. And this can be done by Ministry of Public Health, who control all the public hospitals, about 70% of the beds in the country, or each of the other public hospital, they can also have their own negotiation. But they know the agreed price based on the essential risk. And some of them could get cheaper, but I don't think anyone go higher. And it also depends on the time. Another thing is once they're in, they have a chance to be reviewed and get out. If there's other new medicines coming in or some others decided they want to go cheaper. So this process is not one time. It's a dynamic process. That's why the committee function is continuous.
So I'm Ed, founder and CEO of Reach 52, based in Singapore. Reach 52, we're 8-year-old social business. Take our name from the fact that 52% of the world, or over 52% of the world, can't access essential health services. So we're trying to reach the 52%. The mission and the problem statement is in our name. What we do in practice is three major things. We collect a lot of data on community health needs, speaking to doctors, communities, health workers, understanding gaps in medicine access, gaps in health services, what products are available, not available, expensive, too expensive, to often out of stock, etc. And then we have two main services to fill those gaps that we better understand is training doctors, health workers, and doing screening programs. So supporting service delivery through better training and so on. And secondly, we manage sales, marketing, and distribution of products. So we work with big pharma, generic pharma, consumer health product companies, diagnostic companies to manage the sales, marketing, distribution of products. We start off mainly in Philippines and Indonesia. We're pretty scaled up in India now. That's our main market where we've had significant traction. And more recently, we're operating in Africa as well. You do see some companies doing a lot of product donation. They have innovative treatments, they donate it. You have some companies doing more at cost model. Pfizer has the Accord for a Healthier World. They're saying they're going to make available all their innovative medicines to certain low to middle income countries at cost. So you sort of have donations and then you have these kind of at cost business models. You do see Indonesia, Thailand, India reimbursing some innovative products that align to their strategy. So I think some companies' products are relevant to some country strategies. So in certain cases, you have government reimbursement, of course. You're seeing more patient access and affordability programs. So you have various firms that would look at true ability to pay and look at differential pricing. So yeah, I think it's a spectrum, sort of free and donated, at cost, voluntary out licensing, patient affordability schemes with differential pricing based on income and status. So you can have full price through to various discount levels, right through to government reimbursement, where a company's products align to national goals and policy. And we get a lot of innovators coming to us, sort of saying, "Look, help us with getting the government to reimburse this." And I'm just like, almost like it comes across a bit arrogant to me sometimes. Like, who are you to think the government should reimburse your product versus the million other innovations that are out there in the world, when every time you reimburse something gets pushed out the bottom, right? There's limited fiscal space. So you push something in there to take some money, something falls out the bottom and can't be afforded anymore. No one party can do this alone. As I say, if you imagine all medicines are free unless you've got solid distributors, specialty trained doctors, awareness, availability, it won't move the needle. Hypothetically, if you have too much demand and no supply, then you also, probably in my view, create an ethical dilemma of lots of aware people that they have cancer and no cancer treatments or whatever it is. So it really has to be a multi-stakeholder solution. People think of an affordability as a supply chain challenge. I think of it as structurally low demand. If you have high demand, you have competition. So I think thinking about supply in terms of creating demand and creating viable markets that companies want to serve. It's not like you can just shortcut route to market access, supply chain with a silver magic bullet to find the pot of gold. You have to just commit to access and go through the motions, and it's actually not that expensive. It's just you have to hire some people to do the regulatory work and so on, but there has to be that true commitment to it and actually investing something in it. And it's not like it's rocket science, hyper innovation. You have to think a little bit outside the box and want to do it and maybe take a bit more risk and so on. But yeah, fundamentally, it's a proven playbook, needs commitment, and it's kind of got to stay the course. I think another key part of that is that it's I always say if you make progress in 3 years, that's good. I mean, it has to be a 5-year mindset.